Next question from Micro. A firefighter presents with fever, cough, and lung consolidation. Microbiological testing reveals a gram-negative oxidase-positive organism. The culture shows colonies that exhibit transillumination under light. What is the most likely causative agent? Answer is Pseudomonas aeruginosa. It is a gram-negative oxidase-positive bacillus. Its colonies produce pyoverdin, a fluorescent siderophore pigment causing greenish-yellow fluorescence transillumination under UV light. This aligns with the microbiological findings. It commonly causes pneumonia in immunocompromised individuals or those with occupational exposures. Example, firefighters inhaling contaminated water or soil. Next question is a question from PSM. According to the latest 2024 updates in India's National Immunization Schedule, what is the correct schedule for fractional doses of inactivated polio vaccine? Answer is 6 weeks, 14 weeks, and 9 months. So the 2024 National Immunization Schedule guidelines specify 3 fractional IPV doses. The first dose at 6 weeks, second dose at 14 weeks, and third dose at 9 months. Each dose consists of 0.1 ml administered intradermally. This schedule optimizes the immunogenicity while conserving vaccine resources. Next question from Forensic Medicine. A 10-year-old boy presents with a brownish black scab on his arm after a fall. What is the estimated time since the injury? Answer is 4 to 5 days. A brownish black scab indicates hemoglobin breakdown into hemosiderin and other pigments, characteristic of the late inflammatory phase, 4 to 5 days post-injury. Wound healing timeline is 12 to 24 hours. In acute inflammation, scab is reddish brown due to the fibrin and RBC accumulation. In 2 to 3 days, the scab darkens but lacks the distinct brownish black pigmentation. And in more than 7 days, epithelialization begins and scab edges lift and may detach. Next question from Pharmacology. A 35-year-old obese diabetic man, BMI of 31 kg per meter square, presents with weight gain concerns. Which anti-diabetic drug is least likely to contribute to weight gain? Answer is semaglutide, which is a GLP-1 receptor agonist, and it promotes weight loss via appetite suppression and increased satiety. It delays the gastric emptying and also improves insulin sensitivity. Next question from Dermatology. A 30-year-old female presents with painless genital ulcer on the vulva and painful bilateral lymphadenopathy. She reports a history of multiple sexual partners. What is the diagnosis? Answer is cancroid, which is caused by Haemophilus ducreyi, a gram-negative coccobacillus, which presents with painful genital ulcers and painful bilateral lymphadenopathy, and kissing ulcers because of the auto-inoculation. History of multiple partners support a sexually transmitted etiology here. Next question is from PSM. What term describes a group of tourists following a guide through various attractions? Answer is herd behavior. Herd behavior refers to a group moving together under coordinated guidance, mimicking animal herd following a leader. In tourism, this describes tourists collectively following a guide through sites, prioritizing group cohesion over individual exploration. Next question is from Physiology. In the JVP waveform, what does A wave represent? Answer is atrial contraction. Again, JVP very, very important. Which waves and what does they represent and the conditions related, all these are very, very important. So next question from Anatomy. A clinician touches a patient's eye with cotton, triggering rapid blinking. Which structure carries the sensation for this reflex? Answer is trigeminal nerve. The corneal reflex is an involuntary protective reflex to the corneal stimulation. Example, light touch. Next question from Forensic Medicine. Regarding dying declaration under Indian law, which statement is false? Answer is it must always be recorded by a magistrate, which is a false statement, because Indian law does not require a magistrate to always record a dying declaration. It may be recorded by a doctor, a police officer, village head, or even by a bystander if circumstances demand. That is in imminent death. Next question from BSM. What is the correct sequence of events in a hand-washing awareness session for behavioral adoption in a community? Answer is awareness, interest, evaluation, and adoption. The sequence follows the innovation decision process, the Rogers model for behavioral change in health education. So awareness, initial exposure to the hand-washing benefits. Interest, the active information seeking qualities about the qualities, risks, and the practical aspects. And evaluation, the mental trial to assess usefulness versus existing habits. And adoption, final decision to integrate hand washing into the routine. Next question from Pharmacology. After administering noradrenaline, a patient develops decreased heart rate. What is the underlying mechanism? Answer is stimulation of baroreceptors. So noradrenaline primarily activates the alpha-1 adrenergic receptors, causing potent vasoconstriction and increased BP. This abrupt pressure rise stimulates the baroreceptors in the carotid sinus, and the aortic arch. So baroreceptor activation triggers the baroreflex, leading to increased vagal tone, which causes the slowing of the SC node firing, reduce sympathetic outflow, which leads to decreased cardiac stimulation, and the net effect is reflex bradycardia to counter the hypertension. Next question from pediatrics. A 7-year-old child presents to OPD with painless leg deformity and widening of the wrist. And further investigation shows hypocalcemia, increased parathyroid hormone level, hypophosphatemia with increased ALP levels. And the radiograph is also given, and the radiograph most of the people will be answering this question. So guys, this kind of question you shouldn't make it wrong. The most common cause of this deformity, answer here is rickets. So it is caused by vitamin D deficiency, leading to defective mineralization of the growing bone and cartilage at the epiphyseal growth plates. Again, vitamins are a very, very important topic. A lot of questions keep coming up from vitamins, so please read more about them. So the key lab finding here is decreased calcium, decreased phosphate, and increased parathyroid hormone, and increased ALP levels. Next question from biochemistry. A 4-day-old neonate presents with jaundice and bilirubin level of 5 mg per deciliter. Most probable cause is physiological jaundice. It is the most common cause of neonatal hyperbilirubinemia. The key features are it usually appears in 2 to 3 days after birth, and the peak will be on day 4 to 5, where the bilirubin levels typically become 5 to 6 mg per deciliter in term infants. And the resolution is by dates 5 to 7. Next question from microbiology. A 42-year-old HIV patient presents with altered sensorium and impaired consciousness. Indian examination is positive. Which organism is most likely responsible? Again, the stains and all these things are very, very important. Culture medias, all these are very, very important topics in microbiology. So here the answer is Cryptococcus neoformans. The positive Indian stain is a hallmark diagnostic feature of Cryptococcus neoformans, revealing its thick polysaccharide capsule as a clear halo around the yeast cells. The organism causes cryptococcal meningoencephalitis in immunocompromised hosts, and the symptoms are headache, altered mental status, and coma because of the CNS dissemination. Transmission is via inhalation of the aerosolized yeast from the environmental sources. Next question from PSM. A study monitors 400 low birth weight and 200 normal birth weight infants from birth to age 1 year to assess the protein energy malnutrition development. What study design is this? So answer here is cohort study. Again, study design is a very important topic from PSM. Please learn more about it. How to identify which type of study they are asking in different questions is again a favorite area. So please learn more about it. This is a prospective cohort study because participants are grouped by the exposure status before the disease onset here, and they are followed longitudinally to track the incidence of protein energy malnutrition, and it directly calculates the relative risk, that is the strength of association between birth weight and malnutrition. Next question from PSM. What particle size range of inhaled dust is most commonly implicated in causing pneumoconiosis? Answer is 0.5 to 3 microns. Again, a direct question. Please learn. It's a direct question. Don't make it wrong. Next, based on histological features including chondrocytes in lacunae, isogenous cell aggregates, basophilic territorial matrix, pale interterritorial matrix, and perichondrium with fibrous ocellular layers, which cartilage type is depicted? Answer is hyaline cartilage. So the described features are of hyaline cartilage, where there is chondrocytes in the lacunae surrounded by a glassy, that is hyaline extracellular matrix, and also isogenous cell aggregates indicates the recent chondrocyte division. Matrix zoning is present, and perichondrium with an outer fibrous layer and interchondrogenic layer is also seen. Next question from medicine. A patient with TB and HIV experiences health deterioration 2 months after starting ATT and ART. What is the most likely cause? Again, a very important question. Answer is immunological changes in the body because of a condition, the immune reconstitution inflammatory syndrome is the most probable cause, and it results from rapid immune recovery after ART initiation and triggering the exaggerated inflammation against the pre-existing TB antigens. So we can go through about the pathophysiology and the drug interactions and the details about it. So iris subtypes are paradoxical iris and unmasking iris. Next question is an image-based one. Identify the structure marked in the given hepatobiliary anatomy image. Answer is cystic artery. So it is typically a branch of the right hepatic artery which supplies the gallbladder. Again, these kind of image-based questions nowadays it's coming up. So please have an idea about the anatomy also. It's like quite important nowadays. Anatomy and image-based questions, all those are like a favorite area nowadays in most of the exams. Which histological finding is characteristic of irreversible cell injury? Answer: large amorphous densities in the mitochondria. Large amorphous densities in mitochondria signifies the irreversible injury. These result from calcium influx and phospholipid accumulation, causing permanent mitochondrial dysfunction and cessation of ATP production via oxidative phosphorylation. This change is hallmark of the cell death pathways. Next question from PSM. Mr. X married in 1999, had children in 2002 and 2009, retired in 2020, and then his parents moved in. Which statement accurately describes the phase of this family? Answer is 2002 extension. So it marks the start of the extension phase per family life cycle model. Extension begins with the birth of the first child and ends with the birth of the last child, and it is characterized by family expansion through childbirth. Next question from PSM. Following a massive earthquake in India, which ministry serves as the nodal authority for disaster management? Answer: Ministry of Home Affairs. Again, a direct question. Please learn. Next question from Pediatrics. Which anthropometric measure is the best indicator for chronic malnutrition? Answer is height for age. It reflects the stunting, which results from prolonged nutritional deprivation and chronic insults. It captures the cumulative growth failure over months or years, making it the gold standard for chronic malnutrition. Next question from Biochemistry. A patient presents with arthritis and ochronosis during arthroscopy. Ferric chloride test is positive. Which enzyme deficiency causes this condition? Answer: homogenesic acid oxidase. A homogenesic acid oxidase deficiency causes alkaptonuria, an autosomal recessive disorder in tyrosine metabolism. This deficiency leads to homogenesic acid accumulation, which leads to oxidation to benzoquinone acetate and polymerization into black ochronotic pigment. And ochronosis is the pigment deposit in the cartilage and connective tissues, causing bluish black discoloration and degenerative arthritis. So positive ferric chloride test is where the urine turns greenish black due to the homogenesic acid oxidation. Next question from Pathology. A child with von Willebrand factor disease presents with recurrent nosebleeds and easy bruising and prolonged bleeding. What does von Willebrand factor primarily bind to facilitate platelet adhesion? Answer is GP1b9. So von Willebrand factor primarily binds to glycoprotein 1b9 complex on the platelet membranes. This interaction mediates the platelet adhesion to expose subendothelial collagen at the injury sites, especially under the high shear stress. Example: arterioles. So the pathophysiology in von Willebrand's disease is the deficient or defective von Willebrand factor, and there is impaired GP1b9 binding, leading to delayed platelet plug formation and finally leading to mucosal bleeding. Next question from PSM. What is the correct management for an HIV patient with multiple dog bites? So answer here is rabies vaccine plus immunoglobulin plus wound management, because it becomes a category 3. Again, the rabies management, please go through them. It's very, very important. And about the tetanus also, injection is again very, very important. Please go through that. So here it is a category 3 exposure, and that is why we'll be providing with rabies vaccine, immunoglobulin and wound management. So that's it guys for this video. And if you guys are interested in buying the PDF of my NEETPG video, NEETPG Q Bank, then you can buy it from the link provided in the description. And till I come back with my new video, stay tuned. Till then, bye.